Can lymph node TB relapse after treatment? Have you ever wondered if lymph node tuberculosis can come back after treatment? The answer is yes, it can. Lymph node tuberculosis, also known as tuberculous lymphadenitis, can relapse after treatment, but this is not as common as other reasons for lymph node swelling after therapy. After completing effective anti-tuberculosis chemotherapy, some patients may notice that their lymph nodes have re-enlarged. This can happen for a couple of reasons. One reason for this regrowth is a microbiological relapse. This means that the tuberculosis bacteria, Mycobacterium tuberculosis, have reactivated and are causing an active infection again. Another reason could be a paradoxical reaction. This is when the immune system reacts to the dead or dying bacteria, causing inflammation even though the infection has been cleared. There have been documented cases of lymph node tuberculosis relapsing, with microbiological confirmation of the bacteria found in lymph nodes after treatment. When this happens, it usually requires restarting combination anti-tuberculosis drug therapy. In some cases, surgical excision may be necessary to confirm the diagnosis and manage the condition. However, it is important to note that most cases of lymph node enlargement after treatment are due to paradoxical reactions rather than true relapse. These reactions involve inflammation and swelling of lymph nodes during or after treatment and typically do not need retreatment. Sometimes, residual lymph nodes can persist even after 6 months of therapy. These may still show up on imaging tests, but that does not mean there is active disease or a relapse. Recurrence, which is when new or re-enlarged lymph nodes appear after a period of remission, occurs in about 5% of cases. It is crucial to differentiate between a relapse and a paradoxical reaction or residual lymphadenopathy for proper management. In summary, while lymph node tuberculosis can relapse after treatment, this is relatively rare compared to paradoxical reactions or residual enlargement of lymph nodes. Careful clinical evaluation, microbiological testing, and sometimes surgical biopsy are essential to distinguish between relapse and other causes of lymph node swelling after treatment. If you suspect a relapse, it is important to seek prompt medical care for accurate diagnosis and treatment. Always consult with healthcare professionals for personalized advice and management.